About 750,000 people in Oregon rely on SNAP benefits, also known as food stamps. But soon, there'll be changes to who is eligible, affecting hundreds of thousands of Oregonians, according to the state. Those changes are thanks to President Trump's big, beautiful bill. Part of the bill aims to reduce federal spending on nutrition programs by about $187 billion over the next 10 years. Now, what it means here in Oregon is that for some people, monthly payment amounts may be reduced, and some may lose eligibility for SNAP altogether. The Oregon Senate Committee on Health Care met this week to see how things will change here. Now, one of the most noteworthy is work requirements. Now, able-bodied adults without dependents will have to prove they've worked at least 80 hours a month, or they lose benefits. Before the law passed, veterans, people aging out of foster care, and homeless people were exempt. That's no longer the case, except for some tribal members. The requirement applies for people age 18 to 64, up from 54 before the law. It's already started in 6 counties, and next year the rule goes into effect statewide. Marcy McMurphy, who runs a food assistance program in Eastern Oregon, told the committee people in rural and frontier counties may not be able to meet that requirement.
There aren't enough living wage jobs, especially not part-time work that meets that strict hour requirements. There are a lot of people that want to work that live out here. However, a lot of the jobs that they're qualified aren't available. So if they're not available, how can they then turn around and do the work to meet this requirement?
Oregon's Department of Human Services says 1 in 6 Oregonians are currently relying on SNAP, most of them in rural counties. The average household gets around $313 a month. The average person, $183. Now, under the federal bill, refugees, people seeking asylum, and other legal non-citizens are no longer eligible for SNAP. Senator Lisa Reynolds, who's a doctor representing West Portland and parts of Washington County, says she's worried about the impact of these changes.
I am choked up and I'm nauseated, and I think about my patients, and I think about what it means for a child to go hungry when we think about them not being able to reach their full potential. And so I did a little digging last night on HR 1, and this is from the Congressional Budget Office. Households in the top 10% under HR 1, and these are households making $200,000 to $300,000 a year, will see an average annual gain under HR 1 of $12,000 a year. Lower income households, like the bottom 10%, the numbers you were talking about, $15,000 to $18,000 a year, will lose on average $1,600 a year, which actually in a weird way doesn't sound like that much, but we know what that means to people when it comes to food benefits and access to health care.
Now, on top of this, the law shifts more of the administrative burden onto the state. So the Oregon Department of Human Services says their staff will have an added workload. Now, what that means for you is longer call times, and they say their ability to respond to problems will be limited. Governor Tina Kotek sent out a statement saying, in part, the federal cuts to the Supplemental Nutrition Assistance Program, SNAP, are simply wrong, and they will hurt Oregon families. I strongly oppose these changes. Our top priority now is making sure every impacted Oregonian knows what's changing and where to turn for help.